Good afternoon and welcome to United TV. This is for our 3 p.m. session. It is Bariatric Friday. As you know, we covered various topics in this, and uh, some of them directly involves the bariatric surgery, but there are some actually everyone can benefit from. So, intermittent fasting is one of the tools that we utilize in bariatric surgery, but we also, for in the non-bariatric domain, we also utilize this. Personally, I am, and I know Dr. Irgau does,
Yep.
and we are going to go through this. And there are some videos that we have done before, so we'll bring some new updates. And then utilization of intermittent fasting in the bariatric process is going to be our main focus, but we'll talk about some other issues since this is about the metabolic issue. It's not just someone being having morbid obesity. That's why I think everyone's understanding what intermittent fasting is and how it's utilized in the bariatric surgery process. So, Dr. Gao, how are you doing? And I apologize, we started a little bit late.
No problem at all. I am doing well, and I'm very happy to be back on our wonderful session, Bariatric Friday.
So, intermittent fasting, again, as I mentioned, it's a tool, and there are different options that people can do. Right now, today, well, this week I did cheat a little bit, but today, what time is it? 3:20. My last meal was around 9:30 last night. So I am a little bit hungry. Hopefully, if Anne is watching, maybe she can order me some stuff because I need to eat after this, or I may have one of the Robert chocolate puddings. So um, the 16 to 8, like 16-hour fasting, 8-hour eating. Well, of course, this 8 hour is not, it's a window, it's not just fully eating. And then, or 5 to 2, this is a normal 5 days and restrict the calories, and 2 non-consecutive days. So I think what I'm doing is between the 16/8 and the 5/2. So Monday through Friday, I definitely do it. Well, I try my best to do it. Let's just put it in that way. And there's also 4/3 options. This is fasting every other day. So there are so many different ways. So Dr. Gao, from the clinical standpoint, when you and I we first covered this one, it was probably 3 years now. So uh, would like to kind of talk to you about how we are utilizing this in the bariatric surgery process, and when do you actually decide to do that with our patients?
Thank you. So, essentially, when we talk about intermittent fasting, we are giving a label to a practice which was actually normal human practice before modern life,
Hmm.
right? Modern life has afforded us availability of food on a continuous basis, right? There is food everywhere. And we don't think twice before putting it in our mouths also whenever we see it. In
Hmm.
other words, we live in a society where eating has become a continuous activity, except when you're asleep, essentially.
Hmm.
And when we talk about intermittent fasting, what we're saying is stop for a second and have some type of restriction as to when you allow yourself to eat, right? Because eating continuously is not helping us, right? It is a situation where we're introducing energy into our body, and there is a limit to how much energy our body needs for its energy needs, and the rest is being stored. Is stored as what?
Hmm.
As fat, essentially. And excess fat is what is causing obesity. And we talk all the time about the risks of obesity. So, one way to look at intermittent fasting really is to say to ourselves, how do we defend ourselves from the pervasive presence of food
Hmm.
continuously throughout our waking hours? Well, intermittent fasting is a conscious effort to avoid eating continuously, right? So think about this, Kamal. If you have a car that takes about has a tank that
Hmm.
takes about 12 gallons, you fill it up, right? And this car is supposed to go maybe about 30 to 40 miles per gallon, right? A good energy uh, saving car, right? But if you take this car and fill it up at every gas station that you come across, right? Every 2 miles, every 3 miles, of course you will never run out of gas, but it's a very inefficient way of going about it, right? But that's what we're doing to our body by eating continuously, right? So we're saying let's consciously introduce some limit as to the hours we're going to eat. That is what intermittent fasting is. Now, you've of course talked about different structures of doing this. For instance, you could say to yourself, I am not going to eat until about 12 noon when I wake up, or I'm not going to eat after 4 p.m., right? You are essentially saying to yourself that there are going to be some windows, some restrictions to your eating habits. That's essentially what intermittent fasting is. So I personally believe it would be a good practice for anybody who lives in modern society, because that will allow them to really limit the times in which they're eating. Because we don't need to eat continuously to survive. Absolutely, right? Our ancestors, we went back, hundreds of years, they didn't have the fridge. They didn't have food available wherever they want. Maybe if you were a king, you had food all the time, right? But if you're an ordinary person, you didn't. You just ate when food was available. And then, of course, at nighttime, you went to bed early because there was no activity to hold you there.
Right.
Right now, not only we have activities that hold up very late at night, but we are consuming food continuously when we do that. So no wonder obesity has become such an epidemic, not only obviously in the United States, but also all over the world, because food availability and the practice of continuously eating has become a hobby for everyone on earth nowadays. Now, when we go back to our bariatric patients, you talked about, is there any role for intermittent fasting on patients who've had bariatric surgery? I think there is a role. Perhaps not every bariatric patient, but on some bariatric patients who are struggling, for instance, years after their bariatric surgery, they're struggling with some weight gain. And one of the behaviors I see on people who are gaining weight is that they're introducing too much snacking, right? They are snacking a lot. Of course, after bariatric surgery, the volume of the stomach has been reduced to the extent that they cannot eat a lot of food at one setting, right? And that's a good thing. That restriction actually, despite the myth of the stomach expanding or stretching, that restriction actually, Kamal, persists. People are not able to eat beyond a certain limit after they've had a sleeve gastrectomy or after they've had a gastric bypass. But if they go on snacking continuously, right? If you're sitting by your desk and you have snacks and M&M and you're just eating one piece every 5 minutes, every 15 minutes, then even if you have had a sleeve gastrectomy, you're going to introduce so many calories that it's going to be inevitable for weight gain to happen.
Right.
That's where intermittent fasting happens, is to teach people and say, look, say to yourself, these are the hours of the day in which I will permit myself to eat. All the other hours, I'm just going to drink water. I am not going to eat. So I do believe that intermittent fasting is a very important concept as an additional tool to many of our bariatric patients.
And once you are able to start, so it's actually easier. And you don't have to do. When you and I we started, is it almost 3 years now?
I think longer actually now.
Maybe
Yeah,
four.
longer. Maybe
Well, after
four.
COVID, I can't
I think
really guess.
we actually talked about this even before the pandemic. So we're going a
Oh,
few years.
you know what? You're right. With
Yeah.
that British doctor,
Yeah, absolutely.
right?
Absolutely.
So that when first introduced,
Yeah.
and then what we did was we needed, at least I needed someone with me, teaming up with me, and then we were actually checking how we were doing and if we were doing it. So it put some responsibility. So if you want to start this, the best way is to have another friend of yours who is, and they don't have to be in the same location. I mean, you and I, we are not in the same location
Nope.
rest of the week. So uh, being able to just share this with someone, it just goes back to our support group logic and
Absolutely.
why
Absolutely.
in this process we have the support group. So this is this actually simplified my life a lot personally. Like, and I mean, this when I wasn't, I'm not someone who eats a lot anyway, even before. But in terms of helping the daily discipline and knowing when it's okay and when it's not, it just frees up like my time where I can actually, my GI system is working differently when I'm able to do it. So This is kind of interesting, and we'll go back to the bariatric side. It took literally 2 full weeks for me to go back to my regular self after I came back from Turkey. So the time I have 2 weeks there, and easily. Also, I didn't eat a lot still, but different things that was given, and different times, and frequency of those. I mean, if you're in my mom's house, like she thinks you never feel full. Like there's always something to offer, nonstop, and you do give up at some point. So I do, like like it's not like the part that sometimes they forget is we enjoy eating too,
Of course,
right?
of course,
But we don't enjoy the consequences.
of course,
And that consequence is not just gaining weight, but there are other things.
of course.
Like when I eat gluten, my GI system is not great I mean, I have to share this with my mom so she would stop, insisting. But she brought me to that point where I said, okay, here's what happens when I do this. Do you really want me to still eat? But this access and having the culture of pleasing people with food, the term I use, and I know people use, comfort food. When we are low, when we are not feeling so great, we need junk food, right? So we all go through this. But intermittent fasting brings a different type of discipline to our relationship with food and how we are treating our body. Now, when you were explaining the the car and the gas, one of the thing is our body is a machine. So, and it has its normal term, life term, right? And some people are gonna age earlier than the others based on how they use their bodies. So, uh, and this system works in a very different, unique way, where even if I have some snack, it does the same thing that it does if I had the entire turkey.
Yep. Yep.
So the the work it needs to do doesn't change.
Yep. Yep.
So like my example of there's a little thing that I wanna um, heat up, and then I can put it in the microwave for 10, 20 seconds, or I can turn the oven for 1 hour and just waste the time and energy. And we don't need that. So that, like, understanding those, and I think person as they are doing it, they should be looking all of our videos in this one, but they should also watch some of the other videos from the physicians, and it's going to change people's understanding of their relationship with food, at least from my point. But you actually were one of the first people who believed that we could actually use this tool in our bariatric process because we have patients with high BMIs and other reasons that they may not be able to do certain things. Can you actually elaborate that a little bit? How did you
Absolutely,
decide?
absolutely. So in pre-bariatric, in preparation for bariatric surgery, I don't do it as much as I do post-bariatric surgery. But there are patients, for instance, who may be looking at bariatric surgery months, after the consultation. Well, because their schedule doesn't, for instance, allow for them to have surgery right after they've seen me. This could be, for instance, somebody who works in a school system and they're seeing me, let's say in February, and then they decide to have their surgery maybe in June or July when there is a break. Well, so we have a number of months to prepare. And if they're starting with a really very high weight and we want to come down, and if they're open to the idea, particularly if one of the, issues they have is ongoing snacking, I introduce this idea of intermittent fasting to them, and very often, it works very well. It gives them structure. Of course, I do put an emphasis about the importance of making sure that they have adequate nutrition, right? There is eating and there is nutrition, right? Nutrition is obviously paying attention to some important components of what they're eating, whether it's their protein intake, whether they are micronutrients, the vitamins, the minerals, and so forth. It's important. But the other part that is very important in intermittent fasting is adequate hydration, for instance, right? Because when we're eating, the food that we eat, of course, the food that we eat has a lot of water in it, and we're not eating we're obviously missing that components as well. So we have to make up for that by drinking. But the other reason, getting a lot of water is important, Kamal, is because very often we get confused as to whether we're hungry or thirsty, right? And in fact, sometimes we mistake thirst for hunger. So we eat, the feeling goes away, and we think, I was hungry. Well, maybe you were thirsty, and the food that you ate gave you enough water to take away the thirst as well, right? So drinking proactively a lot of water is actually good. So hydration is something that we should be focused on regardless. And very often, actually, you find a lot of people who tell you, I don't like to drink water. They drink other juicy, high caloric,
Well,
high
stick to
sweetened,
water.
right? So
So it's
drink the water. Water is really the healthiest drink you could have. That's what we were made up to drink, essentially, primarily. Exactly.
it's very simple. So if you don't like water for whatever reason, so cucumber, lemon, mint, and ginger.
Great.
So
That gives it
just do it
flavor.
overnight. It should stay overnight, and then next day you have. And then I do refill throughout the day,
Mhm.
but it's a kind of nice touch with no calories.
With no calories, no sweeteners, right? So
If
that's
you get really hungry, so sorry.
yeah.
If you get so hungry at the end of the day, the things inside you can eat them.
There you
I
are, the
have.
bonus as well, right? So essentially what we're talking about is the importance of hydration, right? So I emphasize that with our patients. Not only it's a good, important thing to do, but also it introduces the idea of the importance of hydration for their post-bariatric journey as well. Now, I utilize intermittent fasting, though, a lot more post-bariatric surgery, not immediately after bariatric surgery. It's important for people to understand that the issue of snacking is not really something that is a problem right after surgery. In fact, for the first 6 months, first 12 months, sometimes patients will tell you they feel rarely hungry, right? Their relationship with food is changing in dramatic ways. They're losing weight. In fact, they have to remind themselves to it. So that's not an issue. We're talking about really long term, 2 years, 3 years, 5 years, 10 years after bariatric surgery, right? Patients would go back to these unhealthy eating habits, right? But because they have a very small stomach now, they cannot eat a lot in one session, and they will tell you, okay, I eat a little bit, and then I leave whatever is left there, and I go back to eat a few hours later, right? We don't want to do that. We want to go back to eating only when we are hungry, right? So introducing structure is important. So for instance, if we say to them, okay, you should learn to stop eating after 5 p.m., after 6 p.m., rather than just snacking continuously through the evening. And if they can get into that habit, and remember, as you yourself said, we are creatures of habit.
Absolutely.
Whether they are good habits or bad habits, they're all habits, right? So if you introduce these good habits, they will become habits. They will become second nature, right? And it's not going to be difficult to continue. It's a discipline, absolutely. So I do use this with my bariatric patients in the long term, and very often it will work very well because it will take them away from this continuous snacking. Another term that we utilize to describe this bad habit of snacking continuously is grazing, right? You're going around and you're putting into your mouth everything that you come across, right? Well, yes, your stomach will be able to accommodate it, but it doesn't necessarily mean it's a good thing, right? So getting them into a habit of giving their body a break of several hours where insulin is not raised, where you're giving insulin sensitivity to improve, right, rather than insulin resistance. All these are important and good things. And there is also some evidence, Kamal, that says that by doing intermittent fasting, by expanding the hours in which you are not eating, you're actually giving your body time to do some cleanup in your cells. And that apparently decreases the potential for cancer as well. And therefore, there is a potential of increasing the lifespan as well.
Well, the overutilization of our body. It was like the reason I was saying this nonstop, the oven and the microwave and we keep, like, if you have a car, if you keep driving it and then you don't even stop for gas, and then somehow it's being put into the car. Now, just imagine that car is going to be, in 3 years, it's going to be old. Well, same thing with our bodies.
Absolutely.
So
Absolutely.
every time this whole mechanism has to work, it's reducing the
Lifespan.
lifespan.
Yeah,
So
no
that's that
question.
simple. So, and that's why actually this is originated from age prevention studies. But then they find out that one of the side effects is the weight loss.
Yep. Yep.
Now, I don't know if I missed it, but if I did, if you can repeat it. When we are really hungry for a long time, when we don't eat anything for a long time, can you explain in simple terms with how the glucose is being processed, the role of glucose for how we are actually spending our energy, how our body is utilizing energy and where it's utilizing from? If you can just go through that one more time for me.
Absolutely. So normally what's happening essentially is when we eat, whatever we've eaten is going to be utilized as a ready source for energy, right? That glucose is going to go into our liver, and then, metabolism starts from there, and it's turned into energy that we can utilize. But when we don't eat for a prolonged period of time, there is something called metabolic switch. In other words, rather than using the sugar that we have in our bloodstream or in our liver, our body starts accessing stores of energy, which is in the form of fat in our body, essentially. So that metabolic switch occurs when our body starts using fat for our energy needs. Now, there are certain parts of our body, like our brain, for instance, that have to have sugar. But in times in which sugar is not available, they can use molecules known as ketones. And ketones are things that we can make by metabolizing fat, essentially. And that switch happens. And that switch was something that must have been happening very frequently in our ancestors, for instance, Kemal, because they were hunters and gatherers. And you needed to wait a long time before you find a good hunt, right? In which meant that you were fasting for prolonged period of time, right? So having sugar so readily available must be a very modern thing to our body, right? But our body hasn't really evolved, hasn't had time to evolve to make changes in our biology. So our biology is the one that we had from our ancestors, who had this metabolic switch, which means ability to utilize fat stores for energy needs, essentially, right? So people are not going to die because they haven't eaten for a number of hours or even days, as long as they are getting hydrated, right? In fact, we can go on for several days, if not weeks, without eating, Kamal, as long as we are hydrated, as long as we have micronutrients and vitamins, right? But in our mind, we feel as if we may die if we don't eat. Not true, not true at all. In fact, after we overcome the first, hours without eating, the first couple of days without eating, hunger may not be even present. And if you talk to people who've fasted for days, they will tell you that, right? They may feel hungry maybe the first day or the second day. After that, they don't, because the body switches.
19 hours right now.
19 hours is when you switch
And
to.
it's not like I'm craving for anything or I'm not starving.
Absolutely. In fact, that's where the switch happens. Typically, you go to ketones after that time frame,
They
because
usually said it's 8 to 12 hours for that metabolic switch.
8 to 12 hours, but for you to go fully into utilizing ketones, it's usually about
Right.
18 to 24
18,
hours.
okay.
24 hours, yeah.
So it just, it helps people, regardless, again, they do bariatric or not. The understanding of this is important. So one of the things that also benefits our patients is, for whatever reason, I mentioned this in the earlier session, the shrinking the liver. When I was with Senator Mary Pinckney, this came up, and shrinking because of the some of the patients cannot afford the robot diet because they use their food stamp, and then we don't take food stamp. So, but the idea was the whole issue of reducing the liver. Now, we are talking about people with high BMI, and what we expect in those cases is that the liver is not as if their BMI was 25, 26. So, and this is actually complicating the bariatric surgery outcome. It complicates the surgery itself, but also complicates, therefore, the outcome of it. Can you actually explain that? And maybe, because if I'm a patient of Krias, and if, let's say, for whatever reason I'm not able to, then I should start the intermittent fasting 4 or 5 weeks before the surgery, to at least make a point of saying that, hey, I lost X amount of weight before the surgery, so then we can actually consider those. I'm not saying that we should or we shouldn't, but this is actually why we are doing it, reducing the liver, and why this is important for bariatric patients and what we can do.
Right. So there are two issues that need to be understood here, Kamal. First is the fact that the liver is large when we are overweight because fat starts depositing into the liver, right? Fatty liver disease, right? Now, when that occurs, the liver tends to become very dense, right? Very dense instead of being soft. And the liver anatomically covers a good portion of the stomach in its position. They're just neighbors. The stomach is just overlying a big portion of.
Right on the
So
side.
it starts from that right side, but it extends all the way to the left, where the stomach is. So the surgeon doing surgery laparoscopically has to push the liver away in order to expose the stomach to do the surgery, right? But if the liver is so hardened and dense and fatty, that maneuver can become dangerous because the liver can actually fracture and create very serious bleeding during surgery. Right? So what we do is we ask patients to be on this specific diet, or even starting earlier with intermittent fasting, to get rid of the fat in the liver, right? And to shrink the size of the liver, but also to make the liver very soft, so that when we're doing the surgery, we can push away the liver safely to expose the stomach and to safely do the surgery. This has been very, very important for bariatric surgeons. In fact, we at Krias adopted this pre-surgery liver shrinking diet that you have called it really very early after we started doing bariatric surgery. And it has served us well, right? Because there were times early in our bariatric surgery practice, actually, where we had to abort surgeries because we could not expose the stomach. The liver was just too big and unyielding. We could not safely expose the stomach,
And
right?
when you are in that situation, regardless of bariatric surgery or not, you have other complications from this large liver anyway.
Yes,
right?
absolutely. So this is with regards to shrinking the liver for the purpose of bariatric surgery. But the other issue I want to address here, Kemal, is that a large and fatty liver is one of the manifestations of a very serious level of obesity, right? In other words, when you look at the deposition of fat in a person, right, there is the obvious fat that you see underneath the skin. Believe it or not, that actually is the least dangerous type of fat deposition. The other type of fat deposition is the one we have inside of our belly, which is called visceral fat. That is the metabolically active and really bad type of fat, right? But there is a third and even more dangerous type of fat accumulation, and that's the fat that accumulates in our liver, right? When our liver accumulates that, our liver becomes sick. And that is the source, really, of many of the problems that we have when we have a deranged metabolism. So, in fact, we were talking in our case conference the other day, if you remember, and we were saying, should we consider fatty liver disease as a serious complication of obesity, just like diabetes, just like hypertension? And the answer is absolutely yes, because that by itself is a source of many problems. So if you have somebody who may not have a very high BMI, and yet they have non-alcoholic fatty liver disease, that person is metabolically ill. That person should qualify for bariatric surgery as well.
And this is also explaining why some people have liver problems if they drink way too much alcohol.
So, yeah, absolutely. So traditionally, before obesity became an epidemic, right, liver disease was the reflection of excessive alcohol intake. Interestingly now, the same pattern of liver disease that we used to see just with alcohol, we're seeing is with obesity. We're seeing it as a result of excessive sugar eating, right? Which means really that maybe there is not very much difference between alcohol and sugar in terms of what they can do to our liver to make it sick. In fact, now in the United States, one of the very, very important reasons for liver transplant is non-alcoholic fatty liver disease. In other words, obesity is becoming a reason for liver transplant, for liver failure, when obesity really goes untreated for a long period of time. That's why we shouldn't wait for a person to have liver failure. We should take care of them by giving them an effective treatment for obesity, and bariatric surgery is one such treatment.
And one last thing on this is, regardless of what you do, you have to have, especially for those patients who are preparing for bariatric, moderate exercise is needed, walking, keeping yourself active. Like, we cannot really rely on any of these things on their own. Like, just one thing and I'm going to do, and, like, this is the disappointment phenomena on weight loss medications, because people think that I will just take this and then my life will change. There's no magic pill. We keep saying this for several years now. And then log your activities and log your fasting breaks. So this also helps you to kind of see everything in front of you.
Mm-hmm.
So, and hopefully this would help those who are looking for different ways to help their process, and also those who don't have the problem, they can actually maybe benefit from doing this and understanding, and kind of delay the aging, right?
Absolutely.
So again, Dr. Irgau, thank you so much for joining us.
My pleasure.
This was a great session for us to be able to understand intermittent fasting, our metabolic switch, understanding liver issues, and with our real-time examples. I believe patients are already enjoying this a lot. This is Bariatric Friday. Next week, we'll be back with our new cycle starting. We'll be back with our bariatric surgery types. So until then, please stay united. Bye-bye.
Bye. Take care.